Age-related macular degeneration, or AMD, as we like to abbreviate it to, is a condition that affects the macula, and it infects people over the age of 60 to 65. Generally, these are people who may not have any risk factors apart from their age, but they may be associated with smoking as well as UV exposure or family history. Essentially, there are two forms of this disease. There's one that's considered the dry form. It's one that we're still working on a treatment for, but at the moment we don't quite have one. Then there's the wet form, and the wet form is what most people would probably be most attuned with. This is where there's bleeding in the part of the vision, the macula, that is responsible for very fine vision. Seeing people's faces, for example, being able to write a card. What happens in the wet form is that there is bleeding that doesn't stop and it continues throughout the retina. And the end stage of this could be blindness. So this is the form that we can actually treat, and we treat it by using intravitreal injections. That's an injection into the eye to stop the bleeding from forming a scar. The intravitreal injections are performed in theatre or in our specialised treatment room. They're done under an aseptic technique, and the reason for this is to reduce the risk of any infections that can occur. Patients are generally anaesthetised first, which means that there is some topical anaesthesia, sometimes drops or a gel, so they can't feel the pain of an injection. In fact, all you ever feel is a little bit of pressure. The injection itself takes less than a couple of minutes to perform, and afterwards patients can return back to normal. We advise patients to be really careful though following the injection, and then even 24 hours after that. The things that I particularly tell my patients to look out for are changes in their vision, such as shadows or dark spots in their vision. These are abnormal and may mean that there are changes in the retina that we need to look at. So they are aware that they need to see us almost immediately when they notice symptoms like this.